Hello everybody, this is Paula from Ohana Therapeutic Massage coming on for our Technique Thursday. And so today we are going to talk about your jaw. And the reason why we're going to talk about your jaw is we find that most people have a lot of tension and everything built up in their jaw, and they don't, one, know if there's anything that can do to help it, and two, don't realize the depth of the problems that can come from having too much tension in your jaw region. And so, yeah, so I'm kind of ad-libbing this as always, and so if nothing else, I'm entertaining. Hopefully you get a little bit of education out of this. If you have any comments, put them in the questions, put them in the comments below, and we'll try to be able to answer them throughout the time, throughout the day today or tomorrow or whenever you happen to be watching this. But some little known facts about your jaw, and I kind of mentioned this before, is that your jaw, your masseter connects from here all the way to the underside of your chin. And that's the main muscle we talk about, but there's also some pterygoid muscles that actually, they're tiny little muscles that keep the jaw connected to itself, or the upper part and the lower part of the jaw, the bones connected to each other. And you're actually supposed to be able to get about a 1/16 inch range of motion sideways, as well as the up and down motion. It's actually like a saddle joint in the jaw region. When you can clench down your teeth, your incisors, or the front part of your teeth, can actually apply about 55 pounds of pressure together. Now your molars, on the other hand, which is your back of your jaw, can when they squeeze together, they can apply about 200 pounds of pressure. And so for those of you who clench your teeth or grind your teeth, that's a lot of pressure that you're putting, and you're just kind of squeezing everything together. And if you have jaw pain or clicking or anything like that, if you bring it up to your doctor, and this is just my experience, and if anybody's had a different experience, please let me know. If you go to your doctor and you mention it to your doctor's going to send you to the dentist. If you go to your dentist and you mention it to your dentist is going to give you a mouth guard, which is going to prevent you from damaging your teeth, but it's not actually going to do anything about that jaw joint that's snapping down on itself. And so that's where your massage therapist can come in hand. And so with that, there's a lot of different ways that we can injure our jaw outside of just clenching or grinding our teeth. There's a lot of people who set their jaw, is how I put it, where they just rigidly hold their jaw in place. They don't actually clench it together, and they don't actually grind it back and forth. They just hold it rigid in place. This causes a massive amount of static tension in the jaw, which can cause headaches. It can cause clicking and lockjaw, where you can't open it or close it. It can also cause tooth pain or sinus pain. A lot of times I see people who grind their teeth a lot are more likely to have a lot more sinus issues as well. And so there's a lot of different things that can happen when we clench our jaw, or we set our jaw, or we grind our teeth. And one way that the jaw is injured that a lot of people don't really realize is whiplash injuries. When you're in a car accident, because of the nature of how your jaw can move, your head goes forward, which brings your, it looks like I am not connecting. Okay. When you go forward, your jaw comes forward, but then when your head goes back in a whiplash injury, it jams back into itself, and so it generally gets injured twice. Once on the forward motion, once on the backwards motion. And so so that causes a lot of tears in those pterygoid muscles, which are all the way back here. But how we as massage therapists can help this is, me and Vanessa both have actually been trained with how to do jaw work, not only from the outside, but from inside the mouth as well, which freaks some people out, but feels amazing, especially if you clench or set your jaw a lot. And so with the craniosacral training that Vanessa's had, and with the myofascial release training that I've had, we actually go in and we can kind of sink back into that joint that a lot of us carry a lot of tension in, and sometimes it can be hypersensitive or like really inflamed back there. And we just gently work into it. We're not forcing anything. We're just kind of gently waiting for the body to allow us in. And then we can actually scoop our finger in and out and really kind of work that whole masseter muscle once we're done working on the pterygoid, which is all the way in the back. And so those are some ways that we can work from inside the mouth. Otherwise, we work from outside the mouth, obviously, cross-fiber friction or decompression or something like that to release the jaw from the outside. But if you do have a lot of issues with it, we would really recommend you talking to your massage therapist if they've been trained to how to work inside the mouth, because if you're only treating the outside, you're only treating half of the problem, because there are muscles that you can only address or really address from the inside too. And so there's a little bit of our technique Thursday about a little bit about the jaw. If there's anything that I did not bring up that you want more information about, just shoot them in the comments below and I'll try to be sure to come on. But otherwise, if you are suffering from jaw pain or headaches or migraines or even tooth pain, getting your jaw worked on from the outside as well as the inside can be really, really beneficial for kind of curbing that pain. Not only that, but the static tension that happens just from carrying that much tension in your jaw, which, by the way, I can tell somebody clenches their teeth before I even touch their jaw, because you'll get tight really, really bad right through here, and your whole temporalis muscle will be super tight as well. And the way you can feel that is if you put your hands right here, and then you open and close your mouth, you can feel it stretch all the way up into here. And so not only does the jaw affect the jaw, but it also causes a lot of tension in your temporalis muscle and back here right behind that neck area. So there is some random information for you guys. We're gonna kind of do this a little bit every single week. And so I believe next week I'm gonna talk about psoas, which is another one of those really, really over abused and under